Hello, my name is Elizabeth Michaud, and I am a graduate student at Auburn University pursuing a degree as a nurse practitioner. Today, I'm going to be discussing the topic of COVID-19. COVID is passed through droplets and close human contact with somebody carrying the virus. Respiratory droplets can be passed as we talk, breathe, cough, or sneeze on one another. And the virus is also passed through airborne transmission as the droplets can remain in the air for approximately 3 hours. So the first case was reported in Wuhan, China in December of 2019. Epidemiologists claim the virus likely underwent a mutation during a zoonotic transmission from pangolins to humans. Johns Hopkins has reported, as of November 2020, the death total in the United States of 257,000. Morphology. I made a COVID molecule. So the red spikes that adorn the sphere are known as spike glycoproteins, which allow the virus to bind to the ACE2 receptors. This is important as they neutralize the antibody and allow the virus to bind to the receptor and enter into the host. This plays a large factor in the vaccine development. Testing. So PCR swabs are the most common form that I've seen within our hospital setting. We're also using inflammatory markers known as C-reactive protein, erythrocyte sedimentation rate, D-dimer, ferritin, troponin, and CKMB. These are typically elevated in COVID patients and are indicative that they might be infected. The incubation period varies between patient to patient. Typically, it's between 2 to 14 days. Initial presentation and the most common symptoms are fever, fatigue, cough, and shortness of breath. Patients are also reporting a loss of sense of taste and smell. The most severe symptoms are associated with hypoxia, and they lead to complications known as pneumonia, acute respiratory distress syndrome, and multisystem organ failure due to the lack of oxygenation being supplied to vital organs. The recovery. After the viral phase, patients may experience symptoms for months due to the damage of their lungs and even chest pain. And the long-term effects are still relatively unknown as this is a new virus that we're being treated. Supportive care is the most beneficial form of treatment that we're using. Oxygenation through nasal cannula or even a ventilator. There's other forms as well, but that's least invasive to most invasive. And then we're using remdesivir and dexamethasone as far as medications go. This is a chart that was found on Johns Hopkins website, and this is how they are determining what to use and when to use it based on severity. For me personally, my mom was diagnosed with COVID in March, and her symptoms were like the typical least severe. She wasn't hospitalized, wasn't requiring any oxygenation. But my fiance's dad, on the other hand, was on the ventilator for 33 days, and his recovery process was really long and went to rehab afterwards, but is now doing better than ever. Professionally, this has changed my nursing career for the rest of my life. I wear a mask every day. I protect my family in different ways than I did before. I take my clothes off before I come home and leave my work shoes in my car to prevent the spread. As a future NP, I will be treating COVID for years to come. And I know that this will impact how I treat patients the rest of my career. I would appreciate any input that y'all have, and I appreciate the opportunity to talk about this and share my experience. Thank you.